So we treat depression, anxiety, PTSD, and bipolar. We do a lot of patients that have the treatment-resistant depression that have tried multiple antidepressants and not seen any effect from those traditional treatments. We're looking at glutamate. Glutamate is found in abundance in the brain. Focus on a different mechanism of action, So there is hope. There's a totally different treatment that works. We take more of a holistic healing approach when it comes to ketamine. We focus in on intention setting. We focus in on creating a very calm and relaxing environment. We may take that extra time to really go over their concerns and questions before they get started to provide a sense of safety. We make sure that we are following, mental health questionnaires every time you come in. There aren't many contraindications. It's a very safe drug. There aren't as many side effects as, your antipsychotics, the weight gain, the glucose, you're putting yourself, at higher risk for diabetes. They don't have these side effects, which is very important when you're looking into a new medication. So we offer Spravato treatments, which is called S-ketamine. It is a nasal spray. The induction period's a little different than ketamine, so you will come to us 2 times a week the first month and once a week the next month. But it is a really good treatment. We've seen a lot of success with it. Ketamine, you're getting 100% of the medication because it's going in the IV, and there is a little bit more monitoring that goes along with ketamine. The heart monitor, the heart rhythm, the blood pressure, we're monitoring your oxygen, and it works very fast. It can work within days. Sometimes it works the same day, the next day. When patients come in, usually they're typically dropped off for their treatment. They'll come into the waiting room and they'll be greeted by one of our 3 admin. They will then go ahead and fill out a mental health questionnaire. The nurse will come get them. They'll take them back to their own personal room, make sure they're comfortable, make sure they have warm blankets, their music set up, make sure they kind of address their symptoms that they've been having, and then they'll start an IV and connect them to a monitoring system. So we have a heart monitor that we connect, a blood pressure cuff, a pulse ox, make sure they're comfortable again, and ask them if they would like to have them sit in with them during their treatment. We have blanket warmers. We have a galaxy light, which is kind of a calming light in the room. Then they'll go ahead and start their ketamine. Ketamine usually takes about 40 minutes to go through. Ketamine does kind of work the time, so it might not feel like 40 minutes. They'll disconnect them from the monitoring system, take their IV out, and walk them out to the waiting room where they can wait for their ride. Typically, we follow up with patients after their 6th treatment, and then we follow up with Spravato patients after that first month. They can go ahead and schedule a follow-up at any time, which I think is so important because we want to be involved through their whole journey. We really encourage that therapy is alongside of ketamine. I think it works best along with therapy. Providing resources, we do that by making sure that patients have a therapist. We also collaborate with other physicians. So ketamine and Spravato can increase your heart rate and increase your blood pressure just for that specific treatment time. But if you already have a high blood pressure or high heart rate, that needs to be addressed before coming to get treatments. It's important to really kind of set the mood when you come into these treatments and have a sense of safety and security. So I always tell patients if they have something that, they feel safe with, like if they have a stuffed animal or a blanket that they really like, to bring that in because it provides them with a sense of security. You're trying the best you can to do everything to combat your depression and anxiety, and you're not finding any relief. If you're still having a hard time sleeping, if you're only sleeping 3 to 4 hours, if your motivation and energy is just depleted, you can't get out of bed. If you find yourself withdrawing, avoiding people, or you're unable to go do the chores that you need to do, it's time to get some relief. So you can get a hold of us at cincy@newpathwaysclinic.com, or our number is 513-982-6077.